we're talking about history being made in the field of orthopedic surgery, joint replacement surgery, in terms of what you have accomplished, Dr. Hodrick, being the first surgeon to perform a knee replacement with robotic technology. Elaborate on this. Tell us what you've been doing and how many patients you've done.
Sure, it's exciting. It's fairly new technology for knee replacement. You know, there's robotic technology that's been in orthopedics for partial knee replacement as well as hip replacement, but that technology now offers blade technology. So we use a saw blade to perform a knee replacement. So during this procedure, I'm able to use that blade to perform the knee replacement. I'm excited about the technology. I've been able to do about 20 cases here at Centennial Hospital, and I'm excited for our patients here in Nashville and the surrounding areas.
Who does this serve the best and why?
Sure.
What patient would be eligible for this?
Anyone really that's eligible for a knee replacement.
Okay.
You could argue that some of the patients with the worst disease, perhaps with the most crooked knee, would benefit even more, because I believe there's tremendous benefit in some of the alignment technology. You know, we actually use it to be more precise during the surgery, and we're able to line up the knee both in the preparation as well as during the surgery.
So that's what makes this better than the traditional way of doing it.
I think there's several benefits. So as a surgeon, I like to do as much as I can before surgery to make sure things go well during surgery. So with the robotic technology, we obtain a CAT scan or a CT scan of the knee. So instead of using a two-dimensional x-ray, we now have a 3D custom, it's that patient's knee, virtual model that we're able to template or plan the surgery ahead of time. Then during the surgery, we actually get information that's dynamic. So I can move the knee in space, and the computer software tells me where everything is and where I want to make the cuts before I make the cuts. And then finally, the robot assist actually helps me be more precise. So whereas a surgeon, we think in millimeters, the robot thinks in 1/10 of a millimeter. So it's that accurate.
Okay. I mentioned this to you earlier off camera about doing some stories in the past on the use of robotics and other types of surgery. It was prostatectomy, where the surgeon was at the joystick, if you will, on the other side of the room. You said you're in the same field. Explain that.
That's great. It's more of a tool. So I'm still scrubbed into surgery. I'm still controlling the robot. The robot doesn't control me, not yet. So I'm using this as a precision tool, basically, to execute the surgery. So that robot's right next to me and allows me to perform the surgery. So I'm not away from the field at all. I'm there performing the surgery.
Is this technology just for knee replacements, or can it be used for other joints?
Yes, in orthopedics right now, it's available for knee replacement, partial knee replacement, as well as hip replacement. But I think in the future, as if you look at any industry that robotics is involved, I could see this technology being used in shoulder replacement, ankle replacement, spine surgery, where it's also available. But as far as joint replacement right now, it's just around the knee and the hip.
Okay, what are the most common types of joint problems you're seeing in your practice these days?
Sure, we see mostly arthritis. So arthritis, of course, is that mechanical wear away of the cartilage. Patients end up having a stiff, painful knee, limits their activity. That's what we see most in our clinic because we perform joint replacement.
Okay. Is there anything you can do to help prevent the need for a joint replacement? What we can do if we're active, exercise? How can we help ourselves prevent ourselves from getting in your, in your operating room?
Yeah, I think the best thing is to stay active. So, find a way to stay active throughout their life. Now, some of arthritis is pre-programmed, meaning it's genetic, but you can do things like keeping weight off and keeping muscle on and doing weight-bearing exercise. We know that that helps joints. There's some other medicines you can take that doesn't really keep away arthritis necessarily, but maybe controls inflammation. That may help as well. You want to probably avoid any large injuries, so we don't necessarily recommend high impact or extreme sports. Perhaps for older generation.
For the older generation,
correct.
Okay. How do you know when it's really time to have surgery? Because obviously that's usually the last thing you want to do as an individual is to have surgery. How do you know when it's time?
Yeah, it's a lifestyle decision. So when it starts making decisions for you, so if your knee keeps you from doing something or going to a restaurant or going to church, if it bothers you every day, it's really kind of your quality of life. If it bothers your patterns of sleep, or maybe there's things you can't do or things that you want to do, you know, get on the floor with your grandchildren. We hear that all the time. That's when you know it's time at least to get an evaluation, have an x-ray.
You mentioned also before we started on camera about doing a knee replacement on someone in their 90s, which just blows me away.
Yeah.
And you made a comment about a very cool group of senior citizens who are so active in our state.
Yeah,
Do you think we're unique in that way as Tennesseans, or just what you're observing?
I think from my observation, yes. We have a really neat elderly generation of 80s and 90s that are extremely active. And honestly, if you look at probably health in general, if you can get past your 60s and 70s into your 80s, you have a good chance to make it into your 90s. And the 90-year-olds and 80-year-olds that I've taken care of are, I don't like to play favorites, but they're some of my favorite patients because they're extremely active. And they want to continue to be active, but they have knee arthritis. So there's different ways to help them.
And they probably listen to you too, right?
They do.
They're compliant.
Typically, yeah. Typically, that's another reason why they're my favorite patients.
Yeah. Okay. How do you find out more information about this new technology for people who are just interested in reading about it or learning more?
Sure. You can visit our website, www.sjri.com.
All right. Thank you, and congratulations.
Thank you very much.
On this. You've made history.
Thank you. Thanks for
wow.
having me.
We're lucky to have you,
Thank you
in Middle Tennessee. All right. And we'll be back in just a moment. Thank you for watching Community Health Matters. Learn more ways to improve your health at mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.